Hello everybody, this is Andrew. This is day 3 post-surgery for my hip arthroscopy on my left hip to correct femoroacetabular impingement and to repair a torn labrum. As I said before, I got a good bit of information from the video diaries of people who recorded their own recoveries before me, so I'll do the same so that there's just another perspective and a little more information out there about what all is involved in this particular surgery and in the recovery from it. I feel pretty good today. I have not felt a whole lot of pain. Just it mostly feels like the hip and the hip capsule is really tight, like somebody took it and twisted it, kind of wound it together like a rope or a rubber band. Yesterday it felt a little bit sore. Actually, not a little bit sore. It felt a lot sore, like it was a couple of days after having done a hard lower body workout. Didn't feel that so much today. It just mostly have felt that tightness whenever I try to move the leg past just a little bit. I expect that to continue. I am currently still on Percocet. I got a couple of days left of taking that narcotic. It seems to be doing its job. It's keeping the pain in check. I have been using the Arthroscopy machine here. That is this ice and compression therapy. And I've also been using just some regular old ice packs that I got at Rite Aid to keep the swelling down. And the swelling has, just for the most part, stayed down. I get up and move regularly, more than once an hour or so. I have the exercises that I was prescribed by my physician to do in the first couple of weeks before I start physical therapy. I can, as of right now, get my leg. I'm limited to hip flexion of 90 degrees. That's a 90-degree angle between, no greater than a 90-degree angle between the femur and the torso. Again, I'm not even going to come close to that without it aching. I can get it to about right here right now before it starts to feel really tight and a little bit sore, so I don't want to push it, so I don't want to go any further. I can pull it a little bit further if I'm pulling it on my own with my hands. I do that a little bit as one of the exercises, and that helps keep things loosened up. And for the most part, I'm just sitting on the couch, watching TV, hanging out with my brother, playing Nintendo and taking it easy, because that's the protocol. This is not something that can be rushed. I've got my corner set up here with water bottles, things that I need easy within reach. Got this little grabber tool hanging here on the wall, so I can reach out and grab things as needed. This has turned out to be very useful, by the way. So if you're going to go through the surgery, definitely get one of these and keep it within reach. I have the only real anything that I would call a negative effect. Well, get that hung back up there. The only real somewhat bothersome thing, although it's not too terrible, is the side effects of the Percocet. Percocet does tend to leave one with a bit of a dry mouth, so I've been sucking down water and fluids like you would not believe. Percocet also has the side effect of causing constipation. That hasn't let me feel any real stomach discomfort, but I've not been having bowel movements with the same regularity as I would normally. In fact, this is Sunday. I've only had one since Thursday, which is unusual for me. But that'll wear off after another couple of days when I stop taking the medication. And again, it's not causing any real discomfort. It's just something that is a change of note. I fortunately did not experience any ill effects from the anesthesia. Other people report things like a loss of appetite. I most definitely have not lost my appetite. I've just been eating constantly. People report issues with anesthesia such as nausea. Again, that hasn't been the issue for me. I have been taking, in addition to the Percocet, I've been taking I can't remember the second medication. It's to prevent bone from recurring growth. Forgot its name. Also an aspirin every day and a stool softener to help with the constipation just a little bit. Other than that, things are all right. We're just kind of chilling out. Again, I live alone, but I do have family staying with me right now, and that is something I would strongly recommend. For the first week or so, you will need help with things. I've mostly been able to function on my own, but my brother does. It's good to have him here for things like when I go up the stairs for the first time, which I did today. I went upstairs, took a shower, felt great. This was day 3 post-surgery, and that was when, according to my protocol, I was allowed to change the bandage, and that's the first time that you can take a bath. That felt awesome. It was the most awesome shower ever. So we're moving along. We'll continue. I'll do, go up and down the stairs at most one time per day to take a shower for the next couple of weeks. I have my follow-up on, let's see, a week from 2 weeks after the start of surgery, so another, I can't do math anymore. I think another 10 days from now, and I will see what the doctor has to say. I did speak to the surgeon yesterday. No, yesterday was Saturday. Spoke to him on Friday. The results of the surgery were good. There were a few complications that we didn't expect, some things that didn't show on the imaging that he had to deal with. Fortunately, there were no significant signs of arthritis. That was something that was of concern. Bear in mind when you're considering this surgery, if it turns out that the arthritis is more advanced than the imaging indicates, then the surgery may not work. So that is something to keep in mind. In my case, there were some concerning signs on the MRI, but from what the surgeon told me, from what he observed, the things that were evident from the MRI looked to have been caused by the impingements itself as opposed to the onset of arthritis, so that's good news. He did discover that there was some unexpected bony growth in the acetabulum region, which we suspected might be a little bit of the case from the imaging, but when he actually got in there, it was fairly significant. So instead of just having a cam impingement on the head of my femur, I also had a pincer impingement in the rim of the acetabulum that took him a fair amount of time to remove through a procedure called an acetabuloplasty, which we weren't expecting to have to do. But the surgeon was able to do that successfully. He performed the femoroplasty to reshape the head of the femur and then reattached my labrum, which was pretty badly torn. However, it seems that the tissue was still significantly intact. There was enough of it remaining to where the surgeon was able to sew it back on rather than having to construct a new one. From what he told me, thinking of the labrum like the face of a clock, my labrum was torn and detached between the 3 o'clock and 11 o'clock position, which is a big tear. It was starting to tear between the 12 o'clock and the 1 o'clock position, and also between the 2 o'clock and the 3 o'clock position. He had to use 5 sutures to reattach it. That's not the most that I'd ever heard of, but it was on the higher end. So we're gonna have a little bit of recovery time here. Fortunately, not as much as I had anticipated, because there was not the onset of arthritis. There was not significant acetabular cartilage loss. The surgeon did not end up having to perform a procedure that's called a microfracture, where the doctor drills into the bone to stimulate bone marrow growth. I was anticipating that would be needed, and that would have added on to the time of being only 10% or 20 pounds load bearing. Surgeon didn't have to do that, so hopefully my time on the walker and the crutches will be a little bit less than what I expected. But we'll see at follow-up. The doctor will take some images, and then we'll go from there. For now, I'm just going to continue to kind of hang out in the corner here. I'll do my exercises daily, use the Arthroscopy, the ice machine, and the compression machine. Just take it easy. Off work all next week. I'm just going to be sitting here watching TV, getting up once an hour, moving around. Again, remember, that is important. Using my little grabber tool to do whatever I need to do. And we'll get on with this recovery. It's going to be slow, but we'll get it done. And I am confident from the feedback that I got from the doctor post-surgery that this surgery will take care of the pain that I was experiencing, and that soon we're going to be back to running. So let's have at it.